You're tuning in to AWANI Tonight with me, Farhana Sheikh. Malaysia reported a record high of over 9,000 new infections today. And how can we better ensure protection for e-hailing drivers amid the pandemic? That's coming up. After more than a month of lockdown, Malaysia reported a record high of new infections with 9,180 cases today. Disheartening to say the least, but according to Deputy Health Minister Datuk Dr. Nur Azmi Ghazali, one of the main factors contributing to the increase in numbers is the mass testing conducted in areas under the Enhanced Movement Control Order in Selangor and Kuala Lumpur. Of the new cases today, almost half, or about 48%, were recorded in Selangor with 4,400 cases, while Kuala Lumpur with 1,271 new infections. Dr. Nur Azmi Ghazali urged the public to be patient and continue to comply with the SOPs. A total of 77 people lost their lives to the virus today, bringing the total number of fatalities to 5,980. Federal Territories Minister Tan Sri Anwar Musa mooted a proposal to slowly reopen Kuala Lumpur under strict SOPs, once 80% of residents have been vaccinated. He also lauded the success of inoculating 1.3 million KL residents, or 73.4% of the adult population, with at least one dose against COVID-19. He posted in a tweet today the percentage of those vaccinated with the first dose according to states. In the post, Kuala Lumpur stood at the state with the highest vaccination rate, followed by Sarawak at 46.6%, Putrajaya 45.9% and Labuan 38.5%. The states with the least number of people given the first shots are Sabah at 10.1%, Kelantan 12.9% and Kedah at 13.3%. Meanwhile, Finance Minister Datuk Seri Tengku Zafrul Abdul Aziz has been appointed as Coordinating Minister for the National Recovery Plan. The Prime Minister's office announced today that the decision was made at the Special Cabinet Committee meeting on the NRP, chaired by Prime Minister Tan Sri Muhyiddin Yassin. Tengku Zafrul will be in charge of monitoring the implementation of government strategies in tackling the COVID-19 situation in the country. The expansion of gig economies and ride-hailing services during the pandemic had led to the increase in crashes involving e-hailing riders. From January 2020 to June this year, SOCSO reports that 327 accidents had involved e-hailing drivers, with 68% involving motorcyclists. We speak to SOCSO CEO Datuk Seri Dr. Muhammad Aziz Muhammad on these alarming statistics and on how can e-hailing drivers be better protected while at work.
The first thing is we want to instill the importance of safety. We also looking into how we can advise and also train the riders to look into safety riding program, and the aim is to get them to follow the importance of safe riding. For example, we emphasize on the education, on the enforcement, and also on the engineering part, especially on their motorcycle, that everything must be intact before they ride. And the education level is more on getting them to understand about what is safety, and also I think the most important is to get them to ride in the right way, and also to understand how to handle if situation where the risk of them going into accident is going to happen.
He suggested for more e-hailing riders to subscribe to SOCSO. This is important so that they will be supported medically and financially in case an accident occurs.
We need more e-hailing riders to be protected against work-related road accident by subscribing to PEKESO. This is very important for their social protection. And And through subscription, we will allow them to be involved in prevention program and the future of them to understand what is important when they ride motorcycle in terms of their safety. Also, we will support them through SOCSO benefits if accident happen, which include, for example, medical benefit. If most of these motorcyclists, when accident happen, they will go into disability, which we will provide rehabilitation and finally to get them to return to work. And this is very important, rehabilitation, because we don't want them to be bedridden and to be burdened to society or to their family.
As of today, over 72,000 motorcycle e-hailing riders have been actively subscribed to SOCSO out of a total of 80,044.
We'll take a short break. Stay with us.
Ini semuanya di tangan kita bersama.
Amanah di tangan kita.
Of jobs, with most operations required to operate from home for more than a year. Therefore, it does not come as a surprise that 9 of 10 Malaysians in the workforce demand a flexible or hybrid working arrangement post-pandemic. This is according to a survey by Ernst & Young Consulting. How does a hybrid working arrangement manifest, and what are its impact towards overall work productivity in the long run? EY ASEAN's Tan Lee Keng weighs in.
Actually, for employers that have already been using technology fairly extensively so far, they actually did not really see a drop in their productivity. In fact, business run as usual. In fact, some companies actually see productivity increase because employees are actually working harder, working longer, partly due to the fact that they also cannot go out of their home and they would spend most of their time working. But I would say that, having spoken to some clients, some leaders are actually quite uncomfortable running on a hybrid work arrangement because many still prefer to see their employees in front of themselves, work together with them. And when they are out of sight, sometimes they get very worried as to whether they are productive, are they doing their work, or are they doing something else? So that is really a concern that is quite valid. But however, I do think that employees also do not want to betray the trust because many still want to continue with their career, work with the employer. So actually, many are actually trying their best to work as best as they could.
In addition to that, Lee Kang said the flexibility and trust given by employers would in turn allow employees to become more resilient, independent, and work in more creative ways.
Whilst there is a trend towards hybrid work, I think we also should not be completely swayed to the other end of the spectrum. I think it is quite important that the company needs to strike a right balance. The balance is actually the key. You need to make sure the work arrangement you allow the employee to adopt also meet your business objective, because if it does not meet the business objective, the business cannot carry on and the business cannot thrive. So the balance needs to be there. I think for organizations, when they make that decision, they need to first think about how to make the organization thrive and then blend the employees into the equation in order to get the best outcome for both parties.
The highly contagious Delta variant rages on in Southeast Asia as cases climb and countries report a record high number of deaths. This forces governments within the region to tighten measures and introduce targeted lockdowns in hopes to halt the dramatic spikes in recent weeks. Indonesia, the hardest hit in the region, will widen curbs to cover 15 cities in Sumatra, Kalimantan and Papua. These restrictions are similar to those imposed on the islands of Java and Bali until July 20th. The government announced that medical workers will also be given booster shots of the COVID-19 vaccines. Indonesia reported over 38,000 cases today, 6 times the number a month ago, while daily death toll doubled since Thailand announced tighter restrictions, including a ban on gatherings of more than 5 people. a night curfew between 9 p.m. and 4 a.m. and curbs on domestic travel from Saturday onwards in Bangkok and 4 southern provinces. The move to tighten restrictions follows a relentless surge in infections and hospitalizations that have stretched the nation's healthcare system. The new restrictions will last for at least 2 weeks. Vietnam's economic hub Ho Chi Minh City entered a 2-week lockdown today in the hope to contain the country's worst COVID-19 outbreak. The city of 9 million had previously been subjected to travel restrictions for a month, but infection rates were steadily rising. Ho Chi Minh City residents are only allowed to leave home to buy food, medicine and for other urgent matters. Police have set up checkpoints at city borders and only those with negative test results can get in. The Health Ministry said the Delta variant of the virus was found in most of the new cases. After just over 2 months since the end of April when the virus outbreak resurfaced, Vietnam reported more than 20,000 new cases, 10 times the total number it recorded since the beginning of the pandemic. South Korea will raise restrictions to the highest level in Seoul and some neighbouring regions for 2 weeks from Monday, after new COVID-19 cases climbed to a daily record with 1,360 new cases reported as of midnight Thursday. There has yet to be a significant increase in hospitalizations or deaths, but the country's top health official warned the numbers may nearly double by the end of July. Authorities pleaded with Sydney's 5 million residents to stay home as a lockdown in the city was further tightened today. Under the new rules, outdoor exercise of more than 2 will be banned and existing bans on non-essential trips will be more strictly enforced. Sydney is now in its 3rd week of lockdown but continues to post record new infections, with 44 locally acquired cases reported today, the biggest rise this year. Pfizer-BioNTech plans to seek authorization from the US for a 3rd dose of their COVID-19 vaccine within next month. This was based on evidence that a booster shot within 12 months could dramatically boost immunity and maybe help ward off the latest worrisome COVID variants. According to Pfizer, data showed a 3rd shot pushed antibody levels 5 to 10 times higher against the original virus strain and the Beta variant first found in South Africa, compared to the first 2 doses alone. The companies plan to submit the data to the US Food and Drug Administration and the European Medicines Agency and other regulatory authorities in the coming weeks. They believe that a 3rd dose may be needed within 6 to 12 months after full vaccination. Meanwhile, they are also developing a Delta variant-specific vaccine with clinical studies expected to begin in August. Football is coming home, is the chant of England soccer fans at this year's Euro 2020 tournament. But experts warn with it may come COVID-19 too. As the country faces Italy on Sunday in the final at London's Wembley Stadium, epidemiologists in both countries warn that Euro 2020 might fuel the spread of COVID-19 among younger male adults. A study by Imperial College found that in the last month, COVID cases have quadrupled in England, with women 30% less likely to test positive, suggesting that watching football is resulting in men having more social activity than usual. England is facing a new wave of cases fueled by a combination of the Delta variant and its emergence from a 3rd lockdown. Wembley Stadium has already hosted 2 semi-finals this week with crowds of around 60,000 people. Although fans are required to show proof of vaccination or negative test before entry, the World Health Organization has flagged the importance of looking beyond stadiums to pubs and bars where people gather for matches. Already, nearly 2,000 infections alone were linked to Scotland fans travelling to London to watch their team's match against England last month. 1.5 years into the pandemic, Singapore is shifting gears and now preparing to live with COVID-19 as an endemic virus. Tonight on Consider This, we speak to epidemiologist Dr. Hannah Clapham about the Singapore model in which COVID-19 does not paralyze daily life. That is all we have for you on AWANI tonight. Get the latest news update on COVID-19 and COVID-19 vaccines from astroawani.com and Astro AWANI app. I'm Farhana Sheikh. Have a good weekend and we'll see you again.